Hi, OT students. This is Stephanie from PASA OT. And as I said before in my last video, PASA OT is here to help you pass the exam on your very first try. And what I'm going to show you today is a video that have 3 very similar questions with slightly different answer choices. And it is important to read the question and understand what the question is asking you before you answer it. And it's generally not a good idea to try to memorize answers, rather focus on understanding the rationale. So remember, we are here to assist you every single step of the way. So pass the test with PASA OT. So question 1, what is the best OT intervention for a patient who recently fractured his humerus while playing football and he has to now wear a cast for the next 6 weeks? A, tissue massage, B, compensation techniques, C, AROM of unaffected joints, D, reduced tissue edema. So the question is asking for best OT intervention. And the answer is compensation techniques. And the reason for it is because rehabilitation for a patient with a fractured humerus typically involves a team approach, including PT and OT. The main and unique treatment goals of OT in this situation is to help the patient regain independence in his ADLs. In order to achieve this, teaching the patient new ways to perform these tasks, compensation techniques, is usually required. For the patient to be able to perform his ADLs with ease, controlling his pain may be necessary. It is also important to maintain the patient's muscle strength and range of motion of the structures around his immobilized humerus, as immobilization can result in tissue shortening. If a PT is not involved in the patient's care, then the OT or OTA would have to address this as well. So here's question number 2. What is the best OT treatment intervention for a patient who fractured his humerus while playing football and is now wearing a cast? Remember, OT treatment intervention. A, tissue massage to reduce edema. B, rehabilitation techniques to resume ADLs. C, AROM of uninvolved joints of the involved humerus, such as the shoulder, wrist, and fingers. D, PROM of involved joints of the involved humerus, such as the shoulder, wrist, and fingers. So the answer is rehabilitation techniques to resume ADLs. And the reason for this is because rehabilitation of a patient with a fractured humerus typically involves a team approach, including PT and OT. Rehabilitation techniques based on the rehabilitation frame of reference includes concepts of adaptation, compensation, and environmental modifications. The main and unique treatment goals of OT in this situation is to help the patient regain independence in his ADLs. So question number 3. An OT is treating a patient who recently fractured his humerus while playing football. The patient is being treated conservatively and is currently wearing a cast. In this scenario, what is the best treatment intervention for this patient? So remember, best treatment intervention. A, tissue massage. B, AROM of uninvolved joints. C, restoration approach. D, reduced tissue edema. So the answer is AROM of uninvolved joints. An immobilization, such as wearing a cast, can result in tissue shortening. Stretching the tissue helps to maintain range of motion, which will help the patient regain function. The 2 main treatment approaches used in functional rehabilitation are the compensation and restorative approaches. These approaches belong to corresponding frame of reference, which are used to guide OT practices. The restorative approach forms part of the biomechanical frame of reference, which places emphasis on restoring previous function via participation in activity. The compensatory approach forms the basis of rehabilitation frame of reference, in which the aim is to modify the demand a task places on the person. This may be achieved by teaching different techniques and strategies, or may include the provision of assistive equipment and aids. The restorative approach can also be initiated once the cast has been removed. Have a great day studying, students, and we look forward to helping you pass the test with PASA OT.